Hello, everybody. Hello, thank you very much. Thank you. I want to thank Democrats and Republicans in the Senate for unanimously passing the largest financial relief package in American history, 96-0. And I have to say it's the largest by far because the incredible naval hospital ship, the USNS Comfort, which is incredible, actually, when you see it inside, will be underway to New York City on Saturday. So it's going to be leaving on Saturday rather than 3 weeks from now. And I told the governor 20 minutes ago, Governor Cuomo, that the ship will be arriving at New York Harbor on Monday. I think I'm going to go out and I'll kiss it goodbye. The National Institute of Health and the private sector, working closely with the FDA, continue to collaborate to discover and test treatments and therapies that can effectively reduce the duration and symptoms of the virus and very much help people to recover. And I'm firmly committed to bringing these treatments to market very quickly. The numbers that you're talking about, we're a big country. That'd be far greater, far bigger. So when I heard the number, I heard it could be 6 million, could be 7 million. It's 3.3 or 3.2. But it's a lot of jobs. But I think we'll come back very strong. The sooner we get back to work, every day that we stay out, it gets harder to bring it back very quickly. And our people don't want to stay out. We just signed a very big deal with China. They're paying us a lot of money in tariffs and other things. They never paid us 10 cents. Look, China has taken advantage of the United States until I came here with Sleepy Joe Biden and Obama and Bush and everybody else. I'm not blaming them. I'm blaming everybody. They were allowed to $500 billion a year they were taking out. The mortality rate is at in my opinion, you'll have to speak to Deborah, Tony, all of the others, but in my opinion, it's way, way down. And that takes a lot of fear out. It's one thing to have it. It's another thing to die.
In addition to direct payments for American families, the average family of 4 will receive a direct payment of some $3,400. They'll also receive payroll report. Many of the small businesses, even those restaurants that you just spoke about, will now be able to keep people on the payroll for a period of months, even if the restaurant or the business is not open. I'm pleased to report the testing is available in all 50 states. And in partnership with commercial labs across America, this morning we received word that 552,000 tests have been performed and completed all across the United States.
We do have 19 out of our 50 states, to be reminded, that had early cases but have persistently low level of cases, and at this point have less than 200 cases. So that's almost 40% of the country with extraordinarily low numbers, and they are testing. In the model, either you have to have a large group of people who are asymptomatic, who've never presented for any test, in order to have the kind of numbers that were predicted. To get to 60 million people infected, or of 6 million people infected, you have to have a large group of asymptomatics, because in no country to date have we seen an attack rate. The predictions of the models don't match the reality on the ground in either China, South Korea, or Italy. We are about 5 times the size of Italy. So if we were Italy and you did all those divisions, Italy should have close to 400,000 deaths. They're not close to achieving that. So these are the kinds of things we're trying to understand. Models are models. We're adapting now to the reality. There's enough data now of the real experience with the coronavirus on the ground to really make these predictions much more sound. So when people start talking about 20% of a population getting infected, it's very scary. But we don't have data that matches that based on the experience. And there is no situation in the United States right now that warrants that kind of discussion. You can be thinking about it in a hospital. Certainly many hospitals talk about this on a daily basis. But to say that to the American people, to make the implication that when they need a hospital bed, it's not going to be there, or when they need that ventilator, it's not going to be there. We don't have an evidence of that right now.
Certainly, for sure, a vaccine is not going to help us now, next month, the month after. But as I mentioned to you, we went into a phase 1 trial, and I keep referring to one vaccine. There's more than one. There's a couple of handfuls of vaccines at different stages of development, but they're all following the same course. And the course is you first go into a phase 1 trial to see if it's safe, and you have very few people, 45 people within a certain age group, all healthy, none at really any great risk of getting infected. And the reason you do that, because you want to make sure that it's safe. Then the next thing you do, and that takes about 3 months, easily, maybe more. So that's going to bring us into the beginning or middle of the summer. Then you go to a phase 2 trial, or what we say 2-3, which means we're going to put a lot of people in there. Now, we hope that there aren't a lot of people getting infected, but it is likely there will be somewhere in the world where that's going on.